Welcome dear viewer to Take Care Show. My name is Dr. Ahmed El Morsy, consultant orthopedic surgeon in the UK. Today we're going to talk about a very important topic in shoulder practice, which is sports injuries that really affect a lot of people, particularly the high level and elite athletes. One of the main injuries they are exposed to is shoulder dislocation or shoulder instability and recurrent dislocation. Shoulder as a joint is ball and socket joint. The socket is surrounded by a rim of cartilage which make the socket is deep enough to contain the head. Following injuries, sometimes this rim of cartilage get injured and resulted in shoulder dislocation. That usually followed by recurrent dislocation on what we call it instability. The aim of this, particularly for elite athletes, is to go back to their normal level of activities, particularly competing activities, as soon as possible. So the treatment journey starts from the right diagnosis, and the right diagnosis is to be done by someone who's really specialized in this. So we start by clinical examination in the office, followed by the right modality of investigation, which is usually in this case is MRI scan. The MRI scan will show us exactly what structural damage you've done with the first dislocation or even with the recurrent dislocation, and based on that we will aim for our treatment. In majority of cases the treatment is keyhole surgery, or what we call it arthroscopic procedure, through a very small incision. Not like in old days when we have to make a big incision there. That's not there anymore. We do 90-95% of all our procedures arthroscopic or keyhole surgery. The aim of the operation is to repair the torn structure in order to be able to go through the rehabilitation protocol so you can get back to normal level of activities as soon as possible. As I highlighted the importance of seeing the right person and get the right operation done in the right time, the rehabilitation afterward is of high importance. You can't really have the operation and that's it. It has to be followed by a course of physiotherapy aiming to get you back to your normal level of activities as quickly and as safely as possible. The best advice I can give you is not to ignore the first injury, because dealing with the first injury would be by far much more easier and give better outcome rather than ignoring the first injury, which will lead to other injuries, and that would make the treatment more complex, and that can delay you regaining your coming back to normal daily activities and particularly to compete to the same level. So please don't ignore the first injury.